And I just want to remind you that this is a call that is, tape, or a meeting that is tape. So don't say or do anything that you won't not want to be, out there for other people to see. I'll go through the slides, and then at the end we'll have a question and answers session. Um, I'll probably have to keep you muted, but what I'll do is I want you to use the chat function and type your questions there. Maybe, wait until the end of the presentation because I may be answering some of those questions. But if you have a question about a particular issue that I discussed in one of the slides, just put your questions there on the chat, and Phil and I will be looking at that and taking the questions at the end and trying to answer them. Um, I want to thank Phil because he's been very helpful, not just with this, but with all our Zoom meetings and all our services and things. So, thank you again, Phil, for doing this. Um, all right. So I just want to talk a few words about the vaccine. Some people are kind of questioning, why the vaccine came so quickly, and, did they skip any steps? And the reality is, yes, this vaccine has been, studied and manufactured in record time. But the truth is that it's gone through all the, clinical and preclinical phases that we have in vaccines to make sure it's safe and effective. There's different phases in where, first the vaccine is given to animals, then to humans, and we evaluate different things. So, even though it's come out at an amazing, speed from the design of the vaccine and the studies to the, manufacturing and distribution, it's gone through all the safety steps that we use to make sure that it's safe and effective. There's several types of vaccine for COVID under, studies. Some are in earlier phases. They're not obviously commercially available. They're not able to be distributed. The two vaccines you're going to be hearing more about is the Pfizer BioNTech and the Moderna vaccine. Those are the two vaccines we have available now in the US. The Pfizer vaccine is kind of finicky in terms of the refrigeration requirements. And that vaccine can only really be given in hospitals or big institutions that have access to that special refrigeration. Has to be kept at minus 70 degrees centigrade, which is like 94 or 90 something degrees Fahrenheit. And like, just to give you an idea, in my hospital, we had to, rent one of those special freezers because it's very difficult, to logistically distribute the vaccine with that, without that, refrigeration. The Moderna vaccine is more like a regular vaccine. It just needs a regular refrigerator, minus 20 degrees centigrade, which is like minus 4 Fahrenheit. But those are the two vaccines that are available, sort of the ones that I'm going to talk about. They're, I don't want to get too technical because this is mostly for people to understand why they should get the vaccine. Is not, a lecture about the biochemistry, but they're based in a relatively new technology. It's been around for a few years, but uses parts of the virus that are inactivated to have your own body generate the response to the vaccine. So it's a kind of exciting new technology. Now, after the vaccine was approved by the FDA, in different states, we had different plans to start giving the vaccine to people. You heard about the phase 1A, which is the current phase that we have. In that phase, the target for the vaccine were healthcare workers. I already got my vaccine. I got the 2 doses. I got some mild, symptoms from the vaccine, and I'll talk about that a little bit later. But a lot of healthcare workers have received the vaccine already. We calculate that around 60% of the healthcare workers have got the vaccine. There's still some reluctance in some people to get the vaccine, including healthcare workers, which is kind of inconceivable to me to some degree, because we are the ones seeing how people die from this infection if you don't take it seriously. Um, but the start of the phase one has been relatively successful for those people that want to get the vaccine. Apart from healthcare workers, there's other categories. People that live in LTCF is like a nursing home, so it's just an euphemism to say nursing home. But people that work or live in nursing homes are getting the vaccine. Then pharmacists, dentists, other healthcare providers. Now. The phases you see there on the slide, there was going to be a phase 1B, a phase 1C, and a phase 2. One of the things that we realized very quickly is that, elderly patients, those over 70%, they need to be vaccinated, because when we look at the numbers with this infection, about 67% of the deaths from COVID are in patients that are older than 70. So that's what is prompted, try to expedite providing the vaccine to the older population. So what DHEC did is, before this Wednesday, there was a plan to follow these phases, and you were going to get notified, either by advertising on TV and radio and newspapers and stuff like that. But what the health department, DHEC is called here in South Carolina, did is, we're just going to start vaccinating, or try to start vaccinating people over 70. And what they did is, starting this Wednesday, okay, they changed things like anything in COVID, things changed in the last minute. So they changed things, and they said, we're going to vaccinate everybody that is, or we're going to offer the vaccine to everybody that is over the age of 70. There's some information here about the DHEC, the health department phone number that you can call. Again, this is going to be taped, so you can access the presentation later, and pause the presentation and take the number. I'm kind of going to let the slide be there for a few more minutes, just so for people that want to write it down. The thing I'll tell you about this phone number is that when you call there, the only thing they're going to tell you is, where do you live? You tell them where you live. It's like, well, this is the hospital or the location closer to you where you can try to call, and they'll tell you to call them. I also heard that, the waiting time to get through on this phone number is very long. So what I'm going to do is, I'm going to show you in the next few slides how to actually try to get this schedule online, because that's going to be much faster for most people, because those phone lines are probably overwhelmed with people calling. And again, they're not going to tell you where, how to schedule you. They're not going to schedule the vaccine for you. They're just going to tell you where to call to get it scheduled. But the key is to kind of use the online. If you're able to do it online, it's going to be much easier for you. One thing, if you want to take notes during this presentation, write down this, oops, let me go back that slide, that website, scdhec.gov/vax okay? That is the website that if you go there, you're going to be able to schedule the vaccine. It's going to give you the information so you can schedule the vaccine directly. It'll take you to a map, and in that map, you'll see some green dots and some red dots. I don't know why they put the red dots, because the red dots means they don't have the vaccine, so why do we care? But anyway, the green dots, if you see a green dot, you are going to be able to click on it. And I'm going to actually try to do this live and see, to show you the steps, okay? So what I did is I put that on my browser, okay, that scdhec.gov/vax and this is the website that comes up. Phil, are you able to see my screen? I just want to make sure that,
yes, yes.
Yeah, okay, good, thank you. So you'll click OK on that and you see those green dots. So let's say you live in the Irmo area. I'm gonna make this a little bigger. Um, so here in Irmo, there's a green dot. You click there and that's Park Ridge. That's the hospital. It's close to I-20. And see, it gives you two options. One is a website and one is a phone number. Again, phone numbers, the phone lines are probably going to be very busy. So if you're web savvy and if not, ask your children, grandchildren, or friendly neighbors to help you with it. But you can just go and click on the website. And I'm just going to test this and it's going to take you to the place where you can schedule it. Okay, so you would click here, vaccine request, and it'll probably ask you to put your name and all that information. Okay, so that's going to be much more efficient if you can do it online using that scdhec.gov /bax locator. Okay, let me make this big again. So this is just like, the 5 or 6 steps that you will follow that I kind of did, live on my web browser. But basically you just look for the green dot, click on it, and it'll give you the information to whether call or go to the website where you can schedule the vaccine. Now, be aware that while the vaccine is available, there's a waiting list, and the waiting list may be weeks or sometimes maybe months. Some people I talk to that had already scheduled their vaccine are getting appointments in 1 or 2 or 3 months. Okay, now that will probably change. The problem is that right now most of the places that are able to give the vaccine for people over 70, they have the Pfizer vaccine. That's the vaccine that is very finicky in terms of the refrigeration, and it's very hard to kind of give it to a lot of people. But once the other vaccine, the Moderna vaccine, is distributed, that can be kept in a regular freezer. And there's already some locations like doctor's cares and urgent care type of facilities that will probably be populating that map where you see the green dots, and that will probably decrease the wait time for the vaccine. All right. Now, a few things to know about the vaccine. Okay, when scientists develop a vaccine, the first thing they look at is the safety. Even before they look at the efficacy of the vaccine, they want to make sure that it's safe. Now, the COVID vaccine is safe. I mean, it's gone through the same rigorous standards of testing and evaluation. The vaccine that is available, Pfizer, has been tested in more than 40,000 volunteers. The Moderna vaccine was in more than 30,000. So there's been a lot of people that got this vaccine before it was commercialized and made available. Okay, so it is safe and it is very effective. I mean, both vaccines, the Pfizer and Moderna vaccine, they have an efficacy in the 94, 95% range. That means that if you get the vaccine, you're still going to have a 5% chance of getting COVID, but you're going to have a 95% chance of not getting it. Now, just to give you an idea of, efficacy with vaccines or seasonal flu vaccines, depends on the year and, the different strains of the virus each year. But the efficacy of the flu vaccine is about, 60, 65, some good years is 70%, because, the different strains and mutations don't allow the vaccine to cover all the strains. So, it's a vaccine that is more effective than the flu vaccine that you've been getting hopefully every year to prevent the flu. Some logistical issues about the vaccine, once you get it scheduled, make sure you bring a driver license, because, a lot of the indications for the vaccine and who gets the vaccine first is going to be based on age. So if you schedule your vaccine because you're over 70, make sure you bring a driver license or some other form of ID to the appointment. appointment because they'll ask you for it. Okay. The other thing I'm going to discuss in the next slide is, the vaccine is in general good for almost everybody, but there's some contraindications, and I'll share those with you. You also need to be aware that there is a vaccine that requires 2 doses. The Pfizer vaccine is 21 days apart, so 3 weeks. The Moderna vaccine is 28 days apart, so 4 weeks. So you'll have to schedule 1 dose and then you have to go back for the second dose. Now, it's okay to get the second dose a few days after the 21 or 28 days. So, I mean, if you cannot schedule exactly on the 21 or 28 days, it's okay. And the other thing you want to know about the vaccine, and we warrant this, when we give the vaccine, and I can tell you this from my own experiences, you're going to have some symptoms, and they're more common with the second dose, because your immune system is already being ramped up, after the first dose. So when you get the second dose, you're going to have some possible symptoms or side effects, and I'll discuss that in following slides too. So who should get the vaccine? Well, pretty much everybody except what is listed there on the left side. It has not been studied in children. The cutoff for the age of the volunteers was 16 for the Moderna vaccine and 18 for the Pfizer vaccine. So in children, I know there's studies that are ongoing. They're in those phases 1 and 2. They're not finalized, but hopefully we'll have the vaccine available for children and adolescents soon. You need to be aware that if you got other vaccine within 14 days or 2 weeks, let's say you got the flu shot, you cannot go next week and get the COVID vaccine. It needs to be 2 weeks apart from any other vaccine. Flu shot, pneumonia shot, tetanus, whatever vaccine, shingles, whatever vaccine you may have got, it needs to be at least 2 weeks apart. Now, if you've had COVID, you can still get the vaccine. Okay, so people that have had a COVID infection, they can still get the vaccine. In healthcare workers, we tell them to wait 10 to 20 days, depending on how sick they were with the vaccine, because they're very high risk. In the population that doesn't have such a high risk, they say you can wait up to 90 days. So let's say you had COVID back in Thanksgiving, so you will be able to get the vaccine in mid-February or so. So just keep in mind, just having the infection is not a contraindication. You can still get the vaccine. And when you fill out, there's a little formulary you fill out before the vaccine. They ask you those questions to make sure you don't get it too early. Also, the other thing to keep in mind is if you had COVID or you were sick enough, if you receive monoclonal antibodies, or if you were sick enough to be in the hospital, which is where you would usually have received convalescent plasma, you need to wait 90 days, because both those things give you an immunity that is expected to last for at least 90 days, so 3 months. Okay, so for people that have received those treatments, they need to wait for sure the 90 days. If you have the infection, you don't need to wait the 90 days, but it's optional to wait 90 days. If you're a high risk, like I have doctors in the hospital, like ICU doctors or hospital-based doctors that had the infection, and I told them, 10, 20 days after you have it, you can get the vaccine because you're going to be exposed again. You don't want to take chances. The last contraindication for the vaccine I want to mention is a history of severe anaphylactic reactions. And by severe, doesn't mean, I had a rash with, when I took some medication or some itching. I mean, these are, reactions that, take you to the emergency room because, your lips or your tongue swells and you cannot breathe, or you develop, whelps all over your skin and you need to get, epinephrine or, EpiPen or treatments like that. So if you had some mild reactions or allergies, you still can get the vaccine. And I presume I'll get some questions about this, but I promise you at the end of the presentation, I'll be taking questions to clarify if there's any questions. Now, one thing that is discussed a lot is other conditions in which the vaccine was not really studied. Like in the studies for the vaccine, they specifically excluded pregnant patients. So the thing is that because it's not a live vaccine, the recommendation is if you're pregnant, um, you can still get the vaccine. And, you can talk to your doctor and discuss it with him or her, but, pregnancy is not a contraindication. Same thing with people that have problems with their immune system. Uh, HIV infection. In both trials, there were patients with HIV that were given the vaccine and they had no problems. The only thing is that they excluded patients with HIV infection with low CD4 counts or T cell counts. Those are the cells that are destroyed by the HIV infection, and they're the ones that protect you from other infections. So they excluded those patients, but is the recommendation from the CDC is that if you have HIV, you still can get the vaccine. Same thing if you have cancer and you're on chemotherapy, or if you take some other medications that are used for like some autoimmune problems, rheumatoid arthritis or lupus or things like that, that they can cause some degree of immunosuppression or affect your immune system, but still you can get the vaccine. It's just you want to talk to your doctors. Uh, Same thing with transplant. Patients that had a transplant, they take medications that suppress their immune system, but again, it's not contraindicated. Now, this I mentioned, the previous infection with COVID-19 is not a contraindication. You just need to be aware that you may need to delay it for some time, okay? But you still can get the vaccine. Um, and then the last thing I want to mention is like we had some patients that get the first dose of the vaccine and then they get COVID after that first dose of the vaccine. In those patients, we're doing the same as if they had the infection. We tell them to wait 10 to 20 days if they're high risk and they can get the second dose. They need to have recovered from the infection, obviously, but they can get the second dose. If it is somebody that is not high risk, they may be worth waiting those 90 days. All right, and I know this is a lot of information, but again, I'll go over at the end through the questions that you may have. The other thing I want to mention is, what to expect after the vaccine, okay? Because, this is a vaccine that is, it can give you more symptoms than, like the flu or some other vaccines. And you need to be prepared and understand that those things may happen. So low-grade fever is common, muscle aches, fatigue, headache. You can develop some pain and swelling where they give you the injection in the deltoid, the shoulder area. And some people feel sick enough that they may not go to work or they may need to take a day off. So it's more common with the second dose. I can tell you that again from my own experience. I took my second vaccine on a Friday, and the following day on a Saturday, I kind of spent the day on the sofa. But I woke up Sunday and I was fine. Went to play tennis. So it's one of those things that if you have the side effects, they're very short-lived. They usually don't last more than 24 hours. But if you have like fever or some of those symptoms that last more than a day or two, or the symptoms start getting worse instead of getting better, then you need to talk to your doctor because side effects and other complications can happen. But again, they're not common. A lot of people get these short-lived symptoms of the low-grade fevers and the headache and muscle aches, but they go away in 24 hours. All right, so this is the last slide. I just want you to remind you that we're going to use the chat function to ask questions. I don't know how many participants we have. We have 17. We don't have too many, so I may break that rule and just take questions directly, but I'm gonna start with having you guys mute and use the chat function, and and then we can just ad lib, and I can take the questions, with you guys and mute. But for now, it's better to stay mute, and after that we can maybe unmute everybody. Is As we say, you have to practice your active listening. And we'll, since there's not too many people on the call, I'll communicate with Phil, and maybe we'll open up for live questions in a moment. Okay. All right. All right. Stop share. All right. So Phil, everybody is muted except you and I. So do you want to read the questions? I couldn't go through the questions while I was doing the presentation. You want to use?
Here's a question.
Mm-hmm.
Has any of the Moderna that's what it is, vaccine been distributed in South Carolina? Do you know of?
Yes, the Moderna vaccine is what they're using in nursing homes. So I know that they started vaccinating patients in nursing homes and employees that work in nursing homes. So they're trying to get more of that vaccine to those green dots that you saw on the map, because that vaccine logistically is much easier to handle, for the pharmacists and the locations where the vaccine is given. But yeah, it's been used already in South Carolina and in nursing homes.
Okay. Do you think the supplies of the vaccine are going to run out? I mean,
I don't think so. The problem we have right now is that the distribution is, the logistical, hurdle. So the distribution is what's stopping from getting the vaccine to more people. I think the supply they have is enough. It's just a matter to get it to the people that need it. So no, I think we'll probably have enough to vaccinate, you know, mostly everybody that wants to be vaccinated.
okay, here's one that says, do you suggest one vaccine type over another?
I don't. I mean, the vaccines were essentially the two vaccines, the Moderna and the Pfizer, is the same technology, that messenger RNA. Um, they both studied, 40,000, 30,000 people in each of those studies. And they're 95, the Pfizer is 94% 95% effective. The Moderna is 94% effective. So they're really, you know, comparable. So I don't recommend one over the other. Now there's other vaccines coming down. The AstraZeneca that you may have heard, they are using that one in England. The efficacy is a little bit different, and it uses a different technology. They use adenovirus, which is a type of virus that will kind of transfer the vaccine material to you. So it's a little bit different. Some people have some questions about that technology because it's a little bit different. But between the two that we have available, the Pfizer and Moderna, I would take either one. They're both equally effective and safe.
Okay, one more. Would you suggest going to a hospital clinic versus a doc in the box, like Dr. Care?
So the vaccines, when they give you the vaccine, you have to sit down for 50 minutes to be watched. They're gonna be giving the vaccines in places where they can, like, if you have some kind of reaction, they can take care of you. But we haven't seen, I mean, we have seen people that get a little dizzy or almost faint. We haven't seen any severe reactions. At least I can speak for Lexington, where we've been giving the vaccine for the last couple of weeks or so. So not really. I mean, I wouldn't get the vaccine in a place where, if you have a problem, you're gonna be, 20 miles from a hospital. So, but I don't think they won't probably choose those places to be a vaccine, distribution site.
Okay. How do they keep the vaccine frozen at drive-in events that last hours?
So they're shipped with like dry ice, and they have they have the Pfizer vaccine, which is the one that requires the -70 Celsius. You have to have a special freezer for that. And what they do is the reason that you need to schedule the vaccine is because they need to know how many vaccine they need to prepare for that day, because after 5 hours the vaccine has to be discarded, so they need to know exactly how much vaccine to unfreeze each day, based on the appointments that they have, so they don't have to waste or throw away the vaccine. The Moderna vaccine is a little bit easier, and that's probably what they will be doing in urgent cares, doctors cares, and places like that.
Okay, that's all the questions that people have sent me.
So do you want to mute people and make it,
Well, they can unmute themselves.
yeah, okay.
No,
All right.
Phil,
Can I ask a question?
I sent you a question earlier, but I directed it to you, not Phil.
Well, go ahead and say it then.
Okay. Linda and I signed up in two different places.
Mhm.
Have any idea what's going to happen with that?
So they'll, the one that, gives you the earlier appointment, they'll probably ask you, they'll ask you, have you got the vaccine anywhere else, or are you scheduled anywhere else? So they'll probably, open up your later appointment once you go to the first one. So, I mean, I would probably not suggest to schedule more than two places, because then it's going to be very complicated.
We didn't schedule, Emilio. All they send you is you send them your email address, and they say they will send you an application. We weren't able to get an appointment.
Oh, you haven't
That address that you gave us,
No, I say we signed up.
that's just an address. That's all that is an address to send your email address to them, so they can send you an application.
Correct.
So that they can send you an appointment.
Correct. Now, but you'll eventually get the email. I mean, I know some people on the call that already got theirs schedule. So, I mean, I don't know, Phil, if you want to put you on the spot, you want to speak to it because you've gone through that process.
Yes, we're guilty of having two scheduled. We scheduled the MUSC for April 1st and April 20th. And the reason I went somewhere else also is that seems screwed up to me. And other people had the same experience where the first date was in April, and then you go to do the second one and it was in February. And so I had contacted Lexington, I believe Lexington Health, and they sent the email, and then eventually they got an email from VAMS, VAMS.
Yeah, that's what.
Yes, that's what we got.
I thought that was so I have to find out that probably wasn't a scam. That really was true. I went in and registered. Liz and I are registered for February 9th at a doctor's care.
Correct. And that email is what will, you'll get to kind of proceed with the appointment, to schedule the appointment.
So I have a follow-up on that, if I could, is that if it doesn't mention a second, I assume that when we have the first at the doctor's care, they will set up the second one.
I can
Correct.
answer that question too, Phil, because I scheduled at doctor's care, and I asked somebody about that who'd already had their first, and they said as soon as they had the first shot, they got an email saying, now you need to schedule your second shot.
Good, thank you.
Have to schedule it.
And also I'm going to doctor's care as well, and I know it's going to be Pfizer, and I guess they're going to do the same process as the drive-in events at doctor's care, because I doubt doctor's care have the big freezers either.
Emilio, do you want to talk about that? I think you said that doctor's care will probably be Moderna.
Yeah, I think that, I mean, some places may be able to give the Pfizer vaccine, like the doctor's care. The problem with that is that, that's why you need to schedule it, because they know that, they're going to have this many people, and, if they don't use that vaccine in 5 hours, it's like after it's, unfrozen and put on the, ready to give. So what I've heard from the health department is they're trying to get the Moderna vaccine out because it's not as finicky with that refrigeration process. But I mean, it's possible they're doing the Pfizer vaccine. It's just that, hopefully the people that are scheduled will show up because otherwise they have to
Mhm.
just give the vaccine to whoever passes by because otherwise it's a waste.
Well,
The
they
reason-
have definite time, we have definite times for the appointment.
And that's why you have to schedule it so they can plan ahead of how much vaccine to have.
The reason that we have two is because we had done the one with Lexington Medical that you showed us.
Mhm,
And then today we got one from Prisma telling us to
mhm,
make it to apply for an appointment.
mhm.
So we're waiting now for the application from either one. We don't have an appointment. We just have, they have our name.
Yeah, you'll get the email from the VAMS, which is the Vaccine Administration Medication Safety.
Yeah, that was the name on it.
Yeah, so you'll get an email from them with the next steps to schedule that appointment.
Emilio, I
Uh-huh.
had asked for, through Lexington, for appointment. Okay, and haven't heard yet. Are they behind now?
All right, so Mary, repeat your question because I couldn't hear the whole thing.
Okay, on Wednesday, I applied to Lexington
Mhm,
asking for appointments for Morgan and me, but,
mhm.
and it said 24 to 48 hours, which have passed, but we haven't heard. The other question is, we had applied to MUSC and
Mhm.
have first appointments like March 10th and second appointments February 2nd. Do you think they would take second appointments first or not?
So Phil mentioned that too. I mean, there's something, a little wacky, I guess, with that, because I mean,
Yes.
obviously the first appointment is before the second appointment, but
Exactly.
now for Lexington, do you use the website to schedule it or
Yes.
Okay. So have you got the email from the VAMS, VAMS? Do you get
No.
that email? Okay. So they're probably behind because
Okay.
I know that, we're doing about 200 a day in Lexington, and pretty much, all days are filled. So even though they say, that's the politically correct way to say, oh, 24 hours, 48 hours, but, in truth, hopefully you'll get an email. If you don't get an email, like let's say Monday or Tuesday, I would call and say, hey, I haven't got any emails, what's going on, but.
Are
I
they
would-
going to work through the weekend?
Say again?
Will they work through the weekend or not until again? So,
They do, I don't think they do Saturdays, but they do Sunday. So I'm not for sure they're doing Sunday.
I would watch look in your junk folder. I almost deleted it. I thought it was a scam. It says, because there are all sorts of scams coming up. It was what is VAMS? I hadn't applied. So just,
Yeah,
Yeah,
that's a good idea. Phil. Just look at your spam and trash folders and it's V as in Victory, AMS, or search your emails folders. You just put that VAMS and see if it's somewhere there.
what about my second question? Do you have any information?
About why the date was.
No, whether if you go to a second appointment first, whether they would take you.
So if you are scheduled and you get a date and a time, I would go because then you just need to tell them, I haven't
They
gone.
don't know it's the second.
So, yeah, it's like, it's the first one and they give you a little card when you get vaccinated, like a vaccination card that has the first date and the second date. Actually, after you get the vaccine, the CDC sends you, a text message every day asking you, are you achy? You have fevers and things like that. So it's
I would go.
pretty well organized, but I don't know why they gave you the second appointment. But I would just go to that second appointment and say, no, it's my first dose, and and they
Millie, there's two
Why?
questions came in. The first one is, how long do you think we'll have to wear masks and socially distance? And
So the general thinking about this is that unless at least 70-80% of the population is immune, there's going to be continuous transmission. So it will take probably until the summer or maybe even later to get everybody, like the younger people is going to be waiting to, late spring and summer to get them vaccinated. So I think it's going to be, definitely the whole winter and spring and probably most of the summer.
okay. The other
And
question
one
is,
thing-
are the doses identical?
Yeah, it's
Okay.
0.5 mLs or whatever. And one thing I wanted to mention, Phil, is like after you get the vaccine will protect you from getting the infection yourself, but we don't know if it protects other people from being exposed. Like you can be exposed to the virus, have your virus in your nose and throat. It's just that the virus is not going to harm you, but you can still transfer the infection to others. So that's why we need to keep wearing the mask and the distance, and we still have to do the whole 9 years until everybody or most everybody is, we build that herd immunity from the vaccination.
Okay, here's another one just came in. So the question is,
Type 1 that's.
if you've had
Our
the
teachers
two
considered it.
vaccine shots, I think this is what it said. Can you then, does your bubble get larger with other people that have had the two vaccine shots? I think what they're, in other words, if you have a family members or I think this, or friends or somebody that have gone through the vaccine, do you have to wear masks with them?
So you probably still have to wear a mask. And I mean, if you're, let's say like in your household, everybody is vaccinated. Okay. I mean, in your household, you don't usually wear a mask because you're close to them anyway. But let's say you go to another household where the other 2 people or 3 people are also vaccinated. Now you won't be getting the infection. I mean, you have only a 5% chance that you'll get the infection, but remember, is still a chance that you can get the infection. There's still a chance that you can transmit it to others. So I would not lower the guard. I would still keep doing, the social distancing and trying to stay away from other people. Because the other thing is, if you start doing that, it may, I think overall is going to be, we're going to have to go through this until the summer. That's my feeling.
Are teachers considered frontline workers for vaccination purposes?
Yeah, they're in the phase 1B, so they will be in the next phase. So they're frontline workers, like people that work in the food industry, transportation, teachers, they're frontline workers.
What about meetings and
Well, they're not frontline. Let me rephrase it. They're not frontline workers. They're essential workers, which is part of the 1B category.
what about meetings and large gatherings, as someone's asked?
Like the question is like, can you just
Yeah,
have those things?
I guess
Vaccine?
I'm inferring that it said if you had been vaccinated, can you go to meetings and large gatherings?
I'm gonna say no until you hear Dr. Fauci telling you that you can do that. No, because again, it's not a 100% effective vaccine, and you don't know which 5% of people in that big gathering may have the infection, and you don't know if you're 95% protected or it's, yeah, I would still, again, it's kind of like a marathon. We've gone through most of the hard part. There's only 5 or 7 miles left, but you want to make sure you finish it, and don't lower your guard before we get to the end.
I read an article recently, very recently, where Dr. Fauci said that somebody said, when will things get back to normal? And after going over a few things, he finally said, the end of this year, like next winter.
Yeah. Yeah, we're gonna have to go through, winter, spring, and probably summer before, before we're all clear.
No more questions.
All right.
Oh,
I was just going to say that I understand that Prisma is going to start offering more vaccines. They're doing their employees now.
Yeah, there's, if you do that map thing, the vaccine locator, you see those green dots, each day I check,
Yeah.
there's more and more, so.
yeah.
And
Now,
no matter what hospital you go through, like I went through Lexington, and it gave me several different places I could go to, and it was Prisma Baptist, Prisma Richland, Doctors Care. It wasn't just Lexington Med. I think Lexington Med was on there as well, but
yeah.
since Doctors Care was close to me, I chose Doctors Care.
Does
So
anybody else have signed up with any other way? I heard today that one of our fellow congregants went to the state fairgrounds
Is this where?
and got a shot today.
No.
No, anybody else has any other way?
You've already said.
Yeah, we were wondering about the new variants and if there's any information yet that's a little more solid on whether the vaccines that we have are going to still be efficacious against them.
So that's a question that probably doesn't have a, exact answer yet, because, the mutation, rates for this virus is not like the flu where, every season there's different strains and all that. The vaccine, is based on what is called the spike protein, is one of those proteins that is on the surface of the virus. And that's pretty much universal regardless of the variant of the virus. So the hope is that it's going to be effective through, like the UK variant. There's also a South African variant. I mean, there's different things that are coming out as different strains of the virus, but because the vaccines are directed to that generic spike protein that is in all the variants, hopefully it'll work for everything. So what we don't know is how long will it last, the immunity, if it's going to be get one every year, or it's going to be you're good after the 2 doses. That's the question.
Okay, if there's no more questions, I'm going to stop the recording. Anybody else?
No, thank you, Emilio.
Thank you so much.
Thank you very much.